Welcome to the EDD podcast, the show that unlocks the real stories and innovations behind the Doctor of Education experience. Each episode welcomes trailblazing educators, industry innovators, and visionary policy leaders who share how their doctorates transformed their lives and their careers. The goal here is simple: for you to laugh, to learn, and get inspired as guests reveal their diverse paths, pivots, and possibilities of the EDD journey. I'm your host, Dr. Minerva, and today I am thrilled to be talking with Dr. JoNise Caleb. Dr. JoNise Caleb is an outpatient clinical administrator with the DeVitz Health Agency, where she oversees daily operations for primary care and specialty practices, serving roughly 40,000 visits a year. She brings deep expertise in grant administration, data-driven quality improvement, and patient experience, supported by her certified patient experience professional credential. Dr. Caleb has taught graduate level courses on communication, leadership, and innovation in healthcare, and has delivered evidence-based seminars to hundreds of patients and caregivers, translating complex information into clear, actionable guidance. Dr. Caleb, thank you so much for being here.
Dr. Minerva, thank you so much for the invitation. And congratulations, my friend, on this podcast that you started. It is much needed. Thank you.
I appreciate that. Thank you. To get us started, when someone asks, what kind of work do you do in the world? How do you introduce yourself and the impact you're trying to make right now?
Okay, well, I am a healthcare administrator, a career healthcare administrator at this point, over 20 years of experience in the field, doing various things. But currently, and I'd say for the past 10 years, I've been on this trajectory of clinic operations. So in my current responsibility, my current role, I call myself the triple advocate. And I'm a triple advocate. So yes, imagine, my Superman cape. I wear 3 of them. I am expected to and do understand the needs of the patients, our clients, the reasons why we're there. And so that shows up in patient experience and access to care. I'm also responsible for our resources to help facilitate the patient care that we give. And so the resources would include the providers, the doctors, the nurses, our front desk team, so forth. And then finally, number 3 is the actual business. How do we get the lights turned on? How do we meet our regulatory requirements? How do we take care of the business side of it so that the doctors can do the doctor things, et cetera? I'm the person who supports that work. And so something that I'm proud of is that I get to support healthcare in a meaningful way. Although I'm not a clinician, my role is impactful because I get to help the clinicians do what they need to do. Kind of the wind beneath their wings, sort of, in a way.
The wind beneath your wings. I love that. And that's important because it's hard to fly without the wind, right?
Right.
You've painted a powerful picture of what your work looks like today. And before we get into the bigger pivots and decisions, can you take us back to an earlier chapter? What was happening in your life, in your career, when you first started imagining a different kind of impact in public health and leadership?
I have had a deep curiosity and interest in going past education into health behavior. And for me, what I've kind of been most interested in is the communication piece. I know that we are familiar with the adage that says it's not always what you say, but how you say it. And I think a lot of health information that we have, there hasn't been a whole lot of change. We know we need to move our bodies. We know we need vegetables and fruit. There's not a lot of innovation. We may have more details to how to curate it for our body types, but for the most part, we have basic ideas of what is required or what is advised, excuse me, to be in a best position to experience good health. However, we don't always do that, right? And so I have been curious to know, how do we bridge that gap? How do we help people? And by the way, I'm people, right? How do we help people um, make the information that they have, that we have, more relevant and easier to adapt so that we can enjoy better health? And so, again, the channel that I've been drawn to is communication. So I learned about health communications. I discovered that that was a field. Wish I had known about it when I was doing my bachelor's degree. And so I had already finished my master's in public health, and I was working in a clinic as a health educator and was looking for programs, more so, I think, certifications at the time, that would give me that insight, just some kind of additional preparation to help connect the actual education to how we speak, how we present information in a way that is more appealing and appreciated by individuals from various walks. And that's how I stumbled upon the field of health communications. And so this was back in 2010 or so. And I'm mentioning that because at that time, look, I'm sounding like I'm dating myself, right? But at that time, there was not the abundance of online education as it is now. It was not as available. And so I needed to find something, because I was not prepared to leave my job and leave where I was. I looked for something close, local to where I was. And that was the program that I eventually applied to and matriculated through, which was Teachers College at Columbia University. I enrolled in the health education doctoral program, but specifically because there were courses that were listed through the curriculum that focused on health communication. And so that's how I entered into the doctoral world. I was against more school, especially the commitment that, in my mind at that point, a doctoral degree required. I just was not interested in that. Also, there was a bit of intimidation. I never saw myself as a doctor. I have to say it that way because that's how it felt, a doctor. I didn't see myself that way, and I was okay with that. So, I really was not aiming for a doctorate degree. It's just kind of where things landed for me. I saw master's programs, and I figured, since I already had a master's program, I didn't need another master's degree. And so that's how I made the decision, because I really was that interested in getting access to that material and that world of health communication, that I signed myself up and enrolled into a doctoral program.
Wow, that sounds like a lot of decision making. And so I'm wondering, what were you hoping your doctorate program would unlock in terms of your voice, your advocacy, or your ability to influence systems with the thought of health communications in mind?
I thought that it would put me in an advantage in terms of industry level context and information specific to communication. Because I kind of had the healthcare piece down, by the work that I was doing. as well as my prior degrees. I did my bachelor's in nutrition, and again, my master's was in public health. So, I had a handle on those aspects, but I really wanted more of the communication, the behavior change, the marketing, social marketing. And so, yes, I just hoped and expected an unlocking of context, uh, personal context, but also, like I said, materials to kind of introduce me into that world.
Noted. And I noticed a long list of letters after your name: EDD, MPH, MS, CPXP. What degrees or certifications came before or after your doctorate, and how do they connect to your journey?
So the MPH, as I mentioned, was earned prior to my doctoral program. And then the MS was earned in the doctoral program. So look, I got another master's out of it anyway. And the EDD is the completion, the product of the program. The CPXP, Certified Patient Experience Professional, I earned that maybe about a year or two post, 1 year after I finished my doctoral program. And I actually let it expire. It expired in October of 2025. I chose not to renew it because I'm not necessarily using it in the work that I'm doing right now. Right now, there's no real advantage to me maintaining that. The listeners may or may not be aware that certifications are also commitments, not just to learning, but to financial obligations. You have to pay for the courses. What is it? The credits, CPUs, the educational units. You have to have a certain amount, which is good. And sometimes it also requires additional membership to maintain the credentials. So for me, at this time, it's not something that I'm using. And should I feel like it's advantageous again, I'll go for it. But, I have it. I have it, even though I'm not. The certification is not current. It expired in October of 2025. But what I am also currently working on, here it is, my fellow of the American College of Healthcare Executives. So if you are familiar with the healthcare world, you'll see a lot of healthcare leaders have FACHE at the end of their initials. That's that credential. And so that's something that I'm currently working on as somebody who, more than patient experience, I've consistently been in healthcare and, am at and working towards executive level work. And so I feel like that is where I'd prefer to invest my time and attention at this point. So, yeah, that's where it is.
That's remarkable. And each one of your degrees and your credentials, they all seem to build on top of each other so naturally. Once you decided to pursue the EDD, how long did the entire process take you?
Ooh. So I started in 2013. I started the fall before, and I graduated in 2021. So that is approximately seven years, 7 academic years that it took me. I have to also add that this was done while I was working full time. I experienced changes in my job. I changed job. I got a couple of promotions in that space. I was also, doing caregiving for a relative, who was living with me. That was maybe about 3 or 4 years of that time. And living life as a 30-something-year-old for the most part, just navigating that. And so I went to school with all of that happening. And I know that there's some people who got it done sooner, But I was also very clear when I started the program because I mentioned earlier, I was not about the school life, right? And so this to do it quickly means that you have to load yourself heavy with courses and things like that. That was not the path that I wanted, and I was clear about that. And I'm happy that I honored that from the beginning. And so I paced myself. I took about 2 classes a semester. That's it. I didn't want anything more. And so that's also what kind of stretched the time out as well.
That's quite the commitment and dedication to be able to have the capacity to care for someone within your household while also working full time, I imagine,
Full time. Yeah.
as well as going to school on a doctoral level. So, speaking of commitment, the EDD is known for being practice focused. Could you share a course or project that really captured the real world application approach, something that made you think this is what practitioner based education is all about?
Before I answer that question, I actually want to go back to the prior question and mention that I worked full time, and that is not a unique thing in doctoral programs. You'll find a mix of individuals, some who, are just doing school and came straight through from their college degree or their master's degree, and their job is school. But you also find, and I found in my cohort, some individuals who were also managing full-time work, family life, and all of that. I think it's also important to note that I had a job that allowed me some flexibility because there were some courses that were offered like early afternoon. My hours were from 9 to 5. And for most of my career, my doctoral career, I had a 3 or 4 o'clock class in another borough, right? And so it required me to be able to leave 2, 3 hours early once a week. And, of course, I'd be able to make it up in other ways. But I could never take that for granted, those are things that allowed me to be able to still earn an income and maintain my experience, my real world experience, as I was also pursuing my degree. So I just wanted to add that. Now, you asked about an assignment or project or course. I actually have a couple of courses in mind that I like to share. Again, health communications and social marketing. That was why I came. And it did not disappoint. One project I believe that we did, it was a long time ago. We're talking a good 10 years ago at this point. But I recall that we dissected a public health campaign to understand the program, the campaign in the context of the health issue that it was trying to address, and then apply some marketing tools, who their target audience was, what methods that they used to reach those individuals, and some short and long-term impacts for those campaigns. So, that was exciting for me to experience. And although it wasn't necessarily me creating a campaign, it was very helpful to reference something like Got Milk or, the bear in the 80s, Smokey the Bear, the ones that we kind of remember if you're a certain age. And so that was really cool. And another one that was relevant to the work that I was doing at that time and forward is Principles of Adult Learning. Just I can't point to any one particular thing, but I remember being in the class and things making sense. And I know that I was able to immediately make adaptations to the way that I was doing the work that I was doing at that time as a health educator and carrying it forward. There was also Principles of Health-Related Behavioral and Social Change. health-related behaviors and social change. And though that course, I think, was helpful on a theoretical level, but and then you don't have to be in a doctoral program to experience this either. But again, this was my experience. One of the favorites was the stages of change, but there were so many. But it was helpful as an educator in my approach to manage expectations for my students, and also to help them manage the expectations of themselves, right? Because sometimes you come down hard on yourself, or you say, yeah, we all do it. I'm gonna do this and do that and never do this again, So I think it was a helpful tool for me to understand people and health behavior better. And again, also communicate that to those who I was working with, whether it was patient or provider, by the way. And so, and then program evaluation, heavy theory in the beginning, and, it wasn't fun. But at the end, there was a logic model tool that was provided, and it's something that I reference to this day. So that was helpful as well.
Yeah, that's an incredible backstory. And I wonder, for those who are listening, how many public health campaigns can you remember? For me, as you speak about dissecting health campaigns, I think about click it or ticket, right? Or I think about, if you say something, or if you see something, say something. So there's so many that we come across that, it just becomes part of our everyday vernacular and way of being, without really recognizing that this is something that helps to save lives through public health communication and efforts.
That's right. And it's so easy that you don't think about it, right? Because it becomes culture. And so it's not always this big, hard decision to make. You have to get to a decision point, but the social, it influences culture so that some things are more socially acceptable, right? Or unacceptable. There was a time, it always amazes me when I go to certain facilities and I'll see that this is a smoke-free establishment, but look at the date, since 2016. I'm like, really? People were smoking in the airport? Or, in the doctor's offices or hospitals, people were doing that up until 2010, or because they have signs that says that. But again, some things become more socially unacceptable, or again, the other way, because of influence by health communication and marketing campaigns. So yes.
Great examples. And that's exactly the kind of learning people imagine when they picture the EDD. The program often talks about forming scholar practitioners. When did you start to feel like one? And what did that look like in your day-to-day work?
I think again, I had the privilege to learn as I was working. And so there were things that I think I implemented in real time, where it may be hard for me to look back and say, oh, specifically this and that. But part of my job from then till now, there's a lot of tracking and data management. There's process improvement and performance improvement, where you're looking at a problem, you are discussing like why it's a problem, who it's affecting, what causes it, or what contributes to it. And then, which again, I'm explaining performance improvement, really. And then just collecting data, thinking about interventions that will help address the different barriers, or, things that are contributing factors to this issue. And then, constantly measuring. And I'll say this, that's something that the program is something that seems so simple, but for me, it just made sense when I heard it. Not just doing all the, research, because that's essentially what it is, right? Doing that research and improvement, but also being able to engage all of the stakeholders. I think a lot of times, the focus is on the clinicians or, the people doing the work and not as much on the people on the receiving end. And so that was something that, again, I was able to make that application more in real time to engage the patients in that process. And engaging the patients also meant being able to translate, what the issues are, what we're finding, getting their voice as well, but also being able to say it to them in ways that make sense to them and that are meaningful to them and have the ability to make the most impact.
Yeah, it sounds like you helped to integrate not only stakeholder management, but stakeholder engagement. And you thought about health literacy, whether or not the patients were actually receiving the message and being able to follow through with the information that they received. Of course, the dissertation phase is where that balance is really tested. You got to work as you went to school. What did a typical week look like when you were deep in data? You mentioned working in another borough of New York City from where you went to school, but you also had to write chapters and manage everything else in life.
Considering getting a doctorate, to really come in with a strong idea or, several ideas of what you would like to do your dissertation on and dig into it, right? So for me, I wasn't quite sure. I had a high level health communication, but I didn't know what to do with it. And so I wish, I have some regrets about that because I wasted time there. But when I finally got to the data collection, writing, etc., analysis, it was a huge commitment. It meant waking up at 4 or 5 in the morning, even though I'm not a morning person, so that I could do a little something before I went to work. It meant after class, so, go to work, then go to class, and then come home. We're talking about 9 o'clock p.m. After class, just really managing life. Remembering to take care of myself, eating and sleeping, getting sufficient sleep so that I could perform at work and perform academically the next day. So just being really intentional and mindful about that. It meant that there was a point where I stopped all the extracurricular things that I was involved in. I had some commitments at church. I was the director of community services for a portion of my doctoral program, and I let that go once my term ended. I was doing something else with school as an alumni leader. I would do Christmas program productions for it was an elementary to middle school. And I did that for about 5 years, but there came a point where I had to put that down so that I could focus on getting out this program. And so it was a time commitment for sure. And it was not always pretty. I also dealt with a lot of anxiety during that time because I was experiencing like there's so much to do. When do I do it? And things like that. But I got through it, obviously, right? But it was commitment. A lot of commitment, a lot of mental, emotional management, self-awareness. Sometimes when I know I need to be doing X, Y, and Z, just paying attention to my mental state, and I kind of wish I had done it a little more than I did, but saying, you know what, I need to sleep tonight. I know this needs to happen, but I need to sleep. I am not somebody who calls out from work. I go to work, okay, but I probably could have taken, some what do you call it? Mental health days. I probably could have done more of those. So yeah, things like that. it would for sure commitment. And I think most people going through dissertation phase experience a version of that where you have to just shut everything out and have tunnel vision so that you can get through it. And hopefully have people in your corner and in your life, including, as I mentioned, if you're employed, supervisors or an employer who are supportive. And if not supportive, at least not working against you, right? So, that's important. And if you have family around, being supportive and mindful of the demands and expectations that they have on you during this time, because it takes a lot of focus there. And again, that's just that. And you need to take care of yourself as well.
Yeah. So please remind us, what part of that was the exaggeration?
Because, I'm telling you, I told you when we spoke offline, when I thought about that, I was like, whoo, that was a rough time. It was a rough time. So, I don't know how everybody else like feels about it, but for me, like there were times when it really did get heavy. It really did get ugly, dark. Like, am I going to get this? Am I going to finish? And again, meanwhile, life is still lifing, life is still very much life, and you have relationships to manage, and you may get sick, or like things are still happening, things happening at work, drama and changes in leadership that you have to navigate, and all these things that you just have to respond to and be available for. And so yeah, it was just a lot. It was a lot, but we did it.
That sounds intense, but also rewarding. Many doctoral students experience moments of doubt or imposter syndrome. Did that show up for you at Teachers College? And if so, how did you push through it?
It did. And it did in different increments. So initially, first of all, I'm at Columbia University in a doctoral program. Me? So that was the first hurdle to climb. That right there. Walking in the buildings are, just huge and immaculate and historic and, all of that. And so walking into those spaces, an Ivy League school, all of that, so I had to get past that. And I will say definitely by by midterms of my first semester, I was like, oh, I'm in the right room. So that was a reassurance that I had. The work I didn't think was difficult. The difficulty was managing, like getting through the volume of reading and, writing that we had to do, again, while I am navigating working and, just the other aspects of life. But I did not find the work hard. I didn't walk and say, I will say statistics and program evaluation might have been the ones where I was like, what's happening here? But it was rare that I had that feeling. I quickly felt and said it, to close friends at that time and family. I feel like I'm in the right room. And so that was a reassurance and an affirmation to me. So there was that. But then there was keeping up with the work while, life was happening. Am I cut out for this? And then I had to get past that. And then when, you want to do well. So when it came to certain projects, especially towards the end of the semester, am I doing it right? Am I going to get a good grade, or are they going to look at this and say, what is this that you're giving me? Super critical, self-critical I am. But we did okay. We did okay. We did more than okay. We did well. I did well. So there was that. Then dissertation time, yeah, there was just, like I said, a lot of anxiety that I was battling. And I'm trying to remember, like, specifically, I think, what it was? Writer's block. I felt like my brain was mud. I would tell people, I said, I set aside 2 hours to do this or 3 hours to do this, and I leave with two sentences. It was very defeating. because I have a whole dissertation to do and I'm just leaving with, 1.5 sentences that I don't even like the next time I come and look at it. So there was imposter syndrome mingled in that as well. But again, the good part about it, or not again, but the good part about doctoral programs and doing things in a school setting is often you have a cohort. And so you have the benefit of people who are doing the same thing that you're doing. And it may not always look the same. We may not have the same lives to manage, but you see people getting through. And so, I had that and, made a couple of friends throughout the process. You were one of the gems that came out of my doctoral program that I, one of the what they say, a free piece of chicken. You were my free piece of chicken, I can't put Minerva at the end of my name as my credentials, but I earned a Minerva friend. And, so I earned a couple of friends that way as well. And those were the things that kind of helped push through imposter syndrome. But like I said, there were different iterations of it that showed up throughout the entire process, even down to defending, because after finishing the defense, it's like, okay, it wasn't as bad as you thought it was going to be. You have to be prepared for sure. But my mind was a bunch of people sitting more like a jury or a judge, to kind of tell you everything that you did wrong and, oh, what are you doing? But the truth is you get a lot of coaching, or at least I had a lot of coaching throughout the process. I had a lot of coaching in my advisor, Dr. Wallace, coach, okay, mother hen coach. And so, we were prepared. I was prepared, but still you think dissertation, the people are going to be looking at me and asking me things, and am I going to know what so, I got past that. And when I finished, I was like, wow, okay, we did it.
Thank you for sharing that so honestly. Was there a belief, quote, or mantra that you learned or leaned on to keep yourself grounded during those late nights and tight deadlines?
The first thing that came to mind when I hear this question is, I just mentioned Dr. Wallace, Dr. Barbara Wallace. I feel like it was the first class, first semester, first course. She put in the syllabus for us to do an exercise on a daily basis. I think we were supposed to do it 10 to 15 minutes a day. And it felt so silly that, I did it. But I was like, okay. Woo-woo. And didn't always do it because, it just felt like when you say your grace, maybe, just like, but the quote or the mantra was, I am calm, centered, and balanced. And later she explained, because I felt like I was a case for her because it was my anxiety. Okay. But later she explained that is precisely why she introduced that, and it introduces that at that point of the career, your doctoral career, is because it is an anxiety provoking experience for many people. That's not uncommon. Maybe when it's happening to you or to me, it feels like I'm the one going through it and, oh my goodness, shame. But people get anxious. People have imposter syndrome. These are things that are commonly experienced. And so she challenged us / assigned us really to say our words. I am calm, centered, and balanced. And as I think about it, I think I need to put that back on the calendar, because I used to have like an alarm that went off. I used to have an alert or an alarm that went off that said I'm calm, centered, and balanced. But I will tell you too that influenced another alert that I still keep on my phone. I am a professional. I'm on purpose. I will do my best with the resources that I have now. And it goes off every day at 1:00. I'm a professional. I'm on purpose. I will do my best with the resources that I have now. That was directly influenced from the I am calm, centered, and balanced affirmation. So those two things were helpful at that time. And again, a reminder to me that I need to reintroduce them. And then another thing is something that I was determined, self-determination, and I'm sure it has a lot to do with how I was raised. But I finish what I start, because there were times when I was like, does this even make sense? I will tell you that in my field of work, you don't necessarily need you don't need a doctorate to do what I do. Not necessarily. You do not need a doctorate to do what I do. And so there were times, financially and also just life, like, does this make sense? Why am I doing this? Why am I torturing? Why am I torturing myself like this? And I came back to, I finish what I start. Now, I know that sometimes you do need to pivot. And so, we do what we need to do. But for me, it was important to finish what I started.
That's powerful. Yeah, I am calm, centered, and balanced, led the way to other words of encouragement that you continue to have on your calendar. That's really remarkable and motivating, that you not only complete what you start, but you also have something to hold on to, sort of as a token or a reward beside your degree, in terms of the words that Dr. Barbara Wallace imparted to you and your cohort. Let's talk about the practical side for a second. Funding a doctoral program could be a huge piece of the journey. I know in some cases, teachers are able to get loan forgiveness, and there are fellowships and there are scholarships. There's a variety of ways in which people fund their doctoral journey. How did you make it work financially? Did you receive scholarships or other forms of support?
I did receive some scholarship. I'd say maybe 15, 20%, it probably covered about 15, 20% of my doctoral program. And in line with, or as we're speaking about scholarships, I also got scholarships that were not related to the doctoral program during that time that were very helpful and beneficial. I went to a couple of conferences, health communications conferences, and actually three of them while I was in the program. And I was able to get scholarships to support that. And so while that was not required, it was something that was important for me. And I was able to earn or, apply for and be granted scholarships to experience learning that was connected or affiliated with my program, but, outside of the program. Those were scholarship funded. So I just thought I'd mention that there. So yeah, I'd say about 15, 20% of it was scholarship. I did one semester. So probably 10% was self-funded out of pocket, and the rest of it was financial aid.
Okay. Well, congratulations on getting those scholarships. Every penny has a cousin and a brother and a sister called nickel, dime, quarter, right? Budgeting and perseverance, two unsung pillars of any degree. Now that you're on the other side, how is your dissertation finding its way into your professional life, especially in the spaces of patient-provider communication and health literacy?
So I do not do much direct patient interaction in my current position. When I speak to a patient, it's normally for service recovery, like some kind of issue. So customer service and issues. But I will say that I work a lot more from the system level, and I work with providers or the chief, like leaders. And so when we're thinking about things that we're rolling out to staff and or patients, I think it's something that I just bring with me to make sure that we're keeping the patient to the forefront and keeping it not just patient-centered, but patient it is patient. It's a form of patient centeredness, but just patient, something that the patient can engage with, that is not too clinical, too technical, and that the things that we present to patients easily have relevance to them and their care right now, that we're able to make those connections immediately. When we are thinking about things that need to happen, we are presenting it in a way that has value to the patient. When we're printing materials, what does it look like? Is it too cluttered? The words that we're using, to try to keep it as simple as possible. And I'll say now, and 10 years ago when I started the program, different day, different time, we have a lot of tools that are available to make that more accessible to anyone. There's AI, and, you can put something through to say, hey, say this big thing, and so a fifth grader could understand it. And I'm saying that because that is the average reading level. It's either third or fifth grade, actually, but the average reading level that we have in our country at this time. So you have tools that can help you make those adjustments, but I think that's how it shows up for me more in as we are instructing and advising the members of the care team how to speak, how to interact with their patients, our patients, just things to keep in mind, as we're doing that.
Yeah, I'm glad that you mentioned AI and your expertise, because as an expert, you know whether or not the information that AI is generating for you, whether or not it's factual or if it's fiction. And so to point out the ways that it may help expedite some tasks is notable. And so, although you're not using your doctorate in your current role per se, how did earning your EDD shape how you see yourself as a scholar practitioner today?
Loaded question. I will say a couple of things. One, I think school in general, um, definitely the doctoral level and also the master's level, you learn how to not just think critically, but also I like to use the word, smell your food before you eat it, right? Like, you look at the resources, references, you're able to look at it and sniff it out and say, well, what do they mean by that? And it says this, but does this mean you're able to process information in a way that helps you to be honest with the information, the data that has already been researched and provided, right? And so I think that is an advantage that I bring with me. That's how I think. That's how, and it doesn't have to be at work. It doesn't have to be in a classroom. And by the way, I didn't mention a way that the doctoral program has helped me is I have also experienced teaching, right? And so I've developed a course on health communication or communication in healthcare. I did that for 2 semesters. And so, that was also something that came, again, I don't necessarily know that I needed the doctoral program to do, but my dissertation, I think, helped me to leverage my expertise in that area for that course.
That's actually great, though. The fact that you talked about your doctoral degree and the bridge to teaching, because a lot of academic positions, they are looking for perhaps adjuncts or even potential tenure track roles to be filled with someone or candidates that have an ARB or dissertation, an ABD, or a doctorate.
But I am also saying that I know that all professors do not have doctorate degrees, right? So I am saying that it is not essential, but it is very helpful.
Okay.
Yeah.
Adjunct professors or full-time professors?
Both. Well, full-time professors, I think, are more likely to be doctoral, holders of a doctoral degree. But adjunct, I see a mixed bag. And I will say that that has been changing. Feel like there was a time where I was not finding any announcements, job announcements. You had to be either ABD, all but doctorate, or excuse me, all but dissertation, or you had to have earned your degree already. But I see more and more where that is not as much of a requirement. So that's what I'm saying. But I also think it's because, we've experienced through that time just an explosion on the availability of information and how people access information and share. And so that's why I'm saying I'm seeing in the real world application, it is not mandatory, but it is an advantage.
That's insight that's going to resonate a lot with listeners, especially those deciding whether or not a doctorate degree is for them or even continued education. So before we wrap up, there are people listening right now who might be thinking, could I do this? Right? Who wants to stay up late at night or go to school before work or go to school after work? What's one myth you want to dispel about earning an EDD and one truth you hope they remember?
I'm not sure what a myth. I'm trying to think of some of the myths that may exist. I will say something that you see online a lot is people arguing, and this is amongst doctoral degree holders, which degree is real or more has more weight. We like to rank things. And so there's conversation, if the EDD is as legitimate or powerful as a PhD, for example. I will say honestly, at least in my space, but I've also said I didn't need this degree to have the job that I have, right? So I have to start there. But in my space, in my world, no, people see a doctorate as a doctorate. Now, amongst my experience with academia is or has been as an adjunct, right? Who plugs in and plugs out. So that's not the world that I'm surrounded by. So maybe in that space there it makes a difference or more of a difference. But, in my world and from the experiences that I've seen, a doctorate is a doctorate. And people who have EDDs are equipped to, one, teach education, right? A doctorate of education. So we're equipped to teach, but also, program development, which is up my lane. That's what I've been doing for most of my career. And so I don't feel at any disadvantage for that, except the disadvantage of, perhaps in some spaces just being overly qualified, and there's some stigma that goes with that. I feel like sometimes people see that you have a doctorate and they want you to do a lot of dancing, you know, do tricks, to prove your value. And yeah, sometimes people challenge you based off of and come with their own assumptions, like, oh, you think you're, and you may not have those attitudes and perceptions that some people kind of expect from somebody who has a doctorate degree. But for somebody pursuing the degree, I can't think of any other myths. You are who you are. You go in as yourself and you come out as yourself. If you're at a space at a place in your career where you're able to earn a doctorate, it's the same as what happened when you finish high school and when you finish college and when you finish your master's, right? You're the same person. You know a little more, hopefully, right? But you're the same person. So I think also, people sometimes like to challenge if you're doctorate, do I call you, and especially for me being in a clinical setting, do I call you doctor or, miss? So there are those conversations. I am not a person who, I told you from the beginning, I was not bent on getting a doctorate degree. So for me, there's some people who that's what they wanted to do. And, for their whole life, I've always wanted to be a doctor. That's not my story. And so, I don't mind being called by my first name or being called Miss whoever, but I have gotten to a point where, respect is respect. And so if we're in an environment where, you're calling this person Dr. So-and-so and this person Dr. So-and-so, well, I'm Dr. So-and-so too. So that is how I navigate that. But yeah, I think the advice that I would give is know your niche, know where it is that you want to go and what you want to do with your degree and make your decision based off of that. Again, I didn't need this degree to do the job that I'm doing and jobs that I'll have going forward, except I do want to do more in academia. And so I think you'll be helpful there. Yeah, that's my answer.
Thank you for sharing that. That is wonderful advice. And you spoke about stigma. And so I'm just wondering, has there ever been a time in which people said that you think you're this or that, or you're better than them, you think you're better than them because you have a doctorate degree?
No, they didn't say it, but they treated me a certain way. For example, when I started the job that I have now, I was introduced to the people and it was heavy on the doctor. This is Dr. Caleb, so I was like, okay. Okay. Dr. Caleb, this is Dr. Caleb. Okay. And so I think they had a certain expectation of, coming with a certain kind of energy, and I don't know. So there was that. And then I don't know if it was because of how I was introduced or again, because of my title, people who did not know me, there was some intimidation that I was, coming to tell them what to do. Honey, I don't want nobody else's job but mine. I do not want your job. But there were people who I could tell, were like, you just standoffish because they thought I wanted to do their job or to take their job from them. And it's only now, I'm like 2 years in, where I'm really getting to know people and they're getting to know me and beginning to relax around me. I want to do my job. And if there's a part of your job that affects my job, I'm going to get involved, but I am not, I promise you, trying to take your job. I do not think that I could do everything, and I think that was kind of what the assumption was, that she may think that she can do everything. Again, how you start the program is how you finish the program. Coming into any space telling you go there and that I don't move like that. I'm an observer and I'll pick where I need to be and work on that space. I don't have the takeover spirit. But, there are people who make that assumption and think that because you have a doctorate that you think you're smarter and you think you know it all and all of that. And again, I'm myself. I don't have any points to prove to anybody.
Wow. Well, thank you, Dr. Caleb. Miss whomever, right? But no, seriously, I really appreciate you being here, Dr. Caleb. Thank you for taking us behind the scenes of your EDD journey. Your honesty, your humor, and the experience you painted for us really captures, what the real lives of scholar practitioners look like. For everyone listening, if this episode has helped you think differently about what an EDD can do for you, can be, who it's for, share it with someone who might need that nudge of encouragement today. You've been listening to the EDD podcast. where EDD stories spark real-world change and help you become addicted to your own growth and impact. If today's conversation made you think, laugh, or dream bigger, hit subscribe, leave a comment or review, and pass this episode along to another current or aspiring EDD who's ready to step into their own leadership. Thank you.